Once upon a time,
In 1986,
there was a nice man,
he was called Dr. Wink White.
and he wanted to make things better.
He had a plan to make a place for people suffering from the kinds of illness that they're unlikely to recover from.
And he wasn't the only nice man.
There was also Dennis Keech, who had a similar idea and helped fund a children's service, and with their help, Keech Hospice Care was born.
It's a really nice place for grown-ups and children.
Patients of all ages can come to receive care and help to manage their symptoms and their pain. Or if they want to, they can stay for care at the end of their life.
While you're there, they look after all your medicine, so you don't miss taking it when you're meant to.
We are a comprehensive hospice team, fully trained and working closely with the NHS. So if it's needed, we can carry out blood transfusions, infusions, and other specialist treatments.
But it doesn't feel like a hospital.
We work very hard to make people as comfortable as possible. There's even a hydrotherapy pool and a restaurant.
It's nice and friendly, and everyone has their own room.
Providing a bed, a comfortable room, and nursing and medical care is just a small part of our work. Because some people prefer to stay at home, Keech has community services that can support them and their family outside of the hospice. We have a register, so we know about the patients in the community. We can provide care in a variety of settings, at home, in hospital, even in school. Patients or other professionals can ring our number anytime they need help and support.
You can have your care in your bedroom, and sometimes you make paintings and songs, and your mum and dad can keep them.
At Keech, we have bereavement care staff, trained volunteer helpers, and music, art, and complementary therapists. We want to help our patients to make happy memories in the time that they have left, and we do our best to support the whole family.
Tell them about Sparklers.
Sparklers is a group for the siblings of children with life-limiting illness, as well as the children of sick parents. But there are support groups for adults too.
And when they need to, your family can stay here too.
We've found that having the chance to say goodbye helps a lot. So families can stay and feel at home in purpose-built accommodation at the hospice, and the families of children who are treated here often stay with us until the funeral.
So they won't be too sad when you're gone.
Right now, we support children from Hertfordshire, Bedfordshire and Milton Keynes, and adults from Luton and South Bedfordshire, as well as brothers, sisters and parents. We've come a long way since 1986, but we believe we can do even more.
And you can help.
Our partial NHS funding doesn't cover all our work, so we are reliant on the kindness and generosity of people in the community. People like you.
You can run a marathon or do a parachute jump.
Whether it is running a marathon, remembering us in your will, or just visiting one of our shops, we're enormously grateful for whatever you can do.
And we'd like to say thank you.
Thank you for helping us to do even more together.